City of Amarillo. At this time, I'm going to go ahead and turn it over to Amarillo Mayor Ginger Nelson.
Thank you, Dave. Good morning, Amarilloans. This is certainly unprecedented and uncertain times that we're in. I want to spend some time this morning talking to you about an announcement that I have, but first I just want to pause and just recognize that the COVID virus has already changed all of our lives. Every single one of us is feeling the effect of it. Some of you have lost your jobs. Some of you have closed your businesses. Our school kids are at home and school activities have been canceled. We're all feeling the change that this virus is bringing on us. And it feels uncertain, and it feels like it's come on fast. But what I want to say to you this morning is that it's not permanent. It's temporary. And this is something we're going to work to fight against. We're not helpless in fighting against it. We can make plans, and we can take action to fight the outbreak in our city. I'm asking you to join us and to go all in and to make the changes necessary to fight the outbreak. From the City Council's point of view, certainly from the mayor's seat, we've been watching the data. And we've said all along that our decisions would be measured, they would be based on common sense, and they would be based on the data that we're actually seeing in our community. We're relying heavily on the recommendations of our local medical team, especially Dr. Scott Milton, who I have a tremendous amount of trust and respect for. We've been watching and listening to our state and our national leaders and watching what's happening in other cities, because Amarillo is a little bit behind the timeline in the outbreak. We're isolated, we're centrally located, and so we have the advantage of watching what's happening in other cities and planning our response based on watching them and watching how they're handling it. So, as we go all in to fight this outbreak, I want to share with you some of the questions that I've been asking. What does it take for us to be safe? What does it take for us to fight this outbreak? What is the data that we should be looking at? And where can our city be working while we're still protecting our medical professional community and staying safe? So I want to take those questions. Y'all just bear with me this morning. I want to take these questions and walk you through them so that everyone understands how we're processing this information. What does it take for us to be safe? The most important thing for us to be safe is for us to slow the spread of the virus. The slower the spread, the more we're allowing our medical professionals to pace taking care of our community. The slower the spread, the more we're protecting our hospital capacity and not having a surge that goes beyond the number of beds that we have to care for people that need to be hospitalized. The slower the spread, it gives us time to find medicine, to develop treatment strategies that will ensure people who do get the virus and have it at a level that they need hospitalization or that type of care will have better outcomes. So what does it take for us to be safe? It's all about slowing the spread of the virus. So how do we go all in to slow the spread of the virus and to fight this outbreak? Well, let's talk about some of the actions that we're seeing people take. Some of them might seem drastic to you, but they're necessary if we're going to go all in and slow the spread and fight this outbreak. For instance, on March 18th, I issued a declaration disaster and a state of emergency here in Amarillo. And as a result of that, we closed the Civic Center. Libraries have closed. Our public buildings here in the city have closed. We've made some changes such as we're not turning off people's water. We're recognizing that it's important for us to not gather in groups of more than 10 people. And we took action in order to do that. We've been asking people, don't go to work if you're sick. Wash your hands frequently. Hand sanitize. I'm going to do that right now even. Hand sanitize frequently. We've been talking about that for the last few weeks. I've been watching as other leaders in our community have taken action. Potter and Randall County, as well as the City of Canyon, have all declared a state of emergency while they're managing slowing the spread and going all in to fight the outbreak. Our school districts have canceled classes. They've done a phenomenal job in the last 2 weeks of creating an entirely new system for teaching our kids from home. Fantastic work, and I just can't say thank you enough to the leadership that we have in our school districts, especially Mr. Loomis, Mr. Flushy. They're tremendous leaders, and they're pulling a lot of weight, and I really appreciate the work that they're doing. We've watched as Governor Abbott has issued orders to close bars and restaurants, and all of that is tied to slowing the spread of the virus, keeping us safe, and fighting this outbreak. Even our local businesses have stepped up, and they're going all in by encouraging their employees to work from home, by investing in new IT systems so that employees can work from home. Thousands of Amarillo employees have now shifted to staying in their homes, going all in to fight the virus, and I'm so grateful for the changes that those businesses and employees have made. I support the measures that all of these leaders have taken. We've got to continue to go all in to fight this outbreak and to slow the spread of the virus. And as our cases rise, we've got to go to the next step to do the same thing, to go all in, to fight the virus, and to slow the spread. Effective immediately, the City of Amarillo will be going to level red on our coronavirus alert scale. We will also go all in to fight this outbreak, and I mean literally go all in. And we need your help, Amarillo. We need all of us to go in our homes and to stay in our homes. So this morning I've signed an amended declaration of disaster that requires us to be all in, Amarillo, requires us to stay in, requires us to shelter in, and be all in to fight this outbreak and to slow the spread. I'm going to talk about the specifics of that order. But first, I want to go back to one of those basic questions that we've been asking, and that is, what data have we been looking at? We've looked at the positive test results and the investigations that each one of those positive test results generates. Anytime somebody tests positive, we do an investigation to determine where were they exposed, and then who have they exposed since they were exposed. And what that does is it creates a chain. So I'm going to draw you a picture of what it looks like. What we're really asking is, do we have community spread in our community? And not just, well, the definition of community spread is, are we spreading it from one community member to another? And not just an isolated case of that, but do we have that now happening significantly in our city? And the answer is yes, we do, and I want to talk to you about the data and how we know that. So, for instance, we have one case here, and we'll call him Person A. And Person A contracted the disease by traveling. He had symptoms on day 1. On day 2 and 3 of his symptoms, he went to work. This is so important, Amarillo. If you're sick, if you have any symptom that might resemble the flu, stuffy nose, feeling lethargic, difficulty breathing, anything that you know you're sick, you know those symptoms. If you've got those symptoms, you can't leave. You've got to stay home. And your family has to stay home, because now all of you have been exposed possibly to the virus. So back to our situation. He went to work on these 2 days. And as a result, he exposed a coworker who is now positive for COVID-19. That coworker went home and exposed his wife, and she's now positive for COVID-19. Not knowing that they had been exposed, they went to a family gathering. So they thought, well, it's okay, it's extended family. But it was a large gathering. And now 2 of their extended family members are positive for COVID-19. This person also went to a party, a shower, and exposed all of those people that were there. So now you're beginning to see how it's spreading from person to person. And they call this in the investigation, they call this the disease spread or the disease chain. And you can see how it begins to make a chain from person to person. And they call this whole cluster a cluster case. This is not the only cluster case that we have in Amarillo. We have more than one. I just chose this one to draw on the board so that you could see what I'm seeing in making these decisions and when I talk with the medical staff about what they're seeing in their investigations. This information tells me we have significant community spread. And that significant community spread means that we need to go all in. And all in is what it's going to take to fight this outbreak. Since the first week of March, the president, the governor, and we here in the city have been asking consistently and constantly, wash your hands, use hand sanitizer, please stay in, work from home as much as possible. If you feel sick, don't go out. And yet, we're still seeing the virus spread. And that tells me as a leader that we need to take some next steps for people to understand how serious this is and for us to try and slow the spread of the virus. So what about our positive case numbers? Right now in Potter and Randall County, we're at 11 positives. Some of us are going to wonder, is 11 positives enough justification for us to go all in? Well, what I see in the data is that it's not based on linear growth. So it's not just based on cases 1, 2, and 3. It's based on the fact that those cases have exposed at least 2 more positives, but exponentially, these people also are exposing. And so when you consider, yes, we have 11 cases, but the virus is not going to grow linearly, it's going to grow exponentially. That data tells me we have more cases than we have currently positive test results. Timing is important. President Trump and his team have emphasized that if we wait too long to go all in, it's going to cost us. And the way it costs us is in lives. We haven't had the testing capacity that we've needed, but we're coming on board with that. And the more we come on board with testing, the more we're going to see that this virus is present in our city. Today at our drive-up testing facility, we have 150 tests available. Tomorrow we'll have more than that. So as our week progresses, we're going to continue. You're going to see a spike in our numbers of people that we were able to test. It's perfectly logical to assume that we're going to see a spike in the number of positive tests. So with that increased testing capacity, our number of positive cases is going to climb, and it might climb rapidly this week and next week. And so I wanted you to hear all of those facts. I wanted you to hear that thinking. If you take those 11 cases, you take the disease chain and the fact that we're having disease clusters like this in our city, that shows that we do have community spread, significant community spread. We've got more than 20 people currently in quarantine, and we've got more than 40 test results that are in progress and we're waiting on. So when you look at those numbers, I think it's very fair to say we're not just talking about the 11 positives we have, we're talking about significant community spread. And I think all of this data does support that it's time, Amarillo, for us to go all in. So let's talk about the specifics of the order. While we go all in to fight the outbreak, what are the activities that it's okay for you and I to do every day? Let me emphasize this. It is okay to go get groceries. So I know what it's like in our community when we step up a level or when we have a weatherman tell us that there's going to be a blizzard. Everybody wants to go to the store for milk, eggs, and bread. and maybe now toilet paper, right? I want to ask you, Amarillo, let's just treat this like a normal week. You go to the grocery store when you can tell your groceries are getting low and you need groceries. The stores are going to stay open. So everybody's going to have access to grocery stores. Just because we've gone to this shelter in place and we're going all in Amarillo, it doesn't mean that you won't have access to groceries. So groceries are definitely still an allowed activity. Medicine, going to get gas needed for your car, any pet supplies, taking care of elderly or someone who needs extra help, that's all allowed. If you need to run to your office and pick up supplies so you can work from home, absolutely do that. Outdoor activities are good, as long as you are practicing physical distance. You must stay 6 feet apart, even if you go outside for a hike or you're perhaps at a park on a walk. You've got to stay physically distant. While we go all in, I think it's important also to talk about where our city can continue working, because our economic burden is getting to be as real as our virus burden. Essential work services and some low-risk businesses are going to stay open. What are we talking about here? You can go to Amarillo Alerts, Amarillo, A-L-E-R-T-S, AmarilloAlerts.com to see the full list of essential businesses and businesses that are going to stay open while we do this all in Amarillo. But I want to be very clear. Grocery stores and restaurants that are doing takeout are staying open. Medical services, not elective procedures, but any other medical care you need is staying open. Businesses that provide food and shelter or social services like our homeless shelters, our food banks, our nursing homes, all of those services are essential and are staying open. Gas stations, auto repair, hardware stores, if you need a plumber or an electrician at your house, those are essential services. Animal shelters are essential. Our animals need to be taken care of during this time too. Banks, financial businesses, legal and accounting, child care facilities, especially child care facilities that enable essential employees to continue going to work will stay open. Funeral services, hotels, motels, and our city transit service will stay open. I've tried to touch the big points there. I encourage every citizen to go to AmarilloAlerts.com and look at the full list. And if you've got any questions, give us a call. We want to help clarify for you what's allowed, what's restricted under this new order. Travel. Travel will be restricted unless it's related to an essential activity. So I'm sorry, teenagers, but no more hopping in the car to go to Sonic and get a Coke. That's not an essential activity, contrary to what my teenage boys might believe. So, employers, I want to specifically ask for your help. You're doing so much to support our city, and you've already made substantial changes to keep your employees and your clients safe. I'm asking, if you're an essential or a low-risk business owner, please continue to consider your employees. Provide them masks, provide them whatever equipment, gloves, hand sanitizer that they need in order to stay safe. Ask your employees what they need to stay safe. And they may have varying levels. You may have some employees who don't feel like they can be at work and still be safe given their personal medical condition or their family situation. I know you'll give them grace, but please reassure them they're concerned about having a job to come back to. Talk through that with them. Tell them what you're thinking as a leader so that there's not uncertainty. You can eliminate as much uncertainty in their worlds through those conversations as you possibly can. Meanwhile, Make hand washing mandatory and hand sanitizing. Maybe you ask your employees to set their watch, and every time the timer goes off, they wash their hands or they sanitize. Let's get really intentional about taking care of our employees who are working at our essential businesses. And I'd like to also ask you employers to limit your businesses by not having any cash transactions. We can take all these measures, but then when we hand employees our cash, and it's covered with germs, we're undermining that. So please turn your businesses to non-cash businesses for this period. And when you make a handoff, I've had several citizens say to me, I went to a business and was able to purchase something that they handed me, but people are not staying 6 feet away when they make these handoffs. So focus on that and ask your employees if they're handing out takeout food or they're handing off groceries or whatever it is your business provides to the public in a handoff, make sure your employees are staying 6 feet away from your clients as they're making that handoff. And employees, I want to speak to you for a minute. Thank you for what you're doing for our city. Thank you for what you're going to sacrifice over the next few weeks as you continue to work in our essential businesses. But be smart. And I want to give you permission to make a decision that you need to make for yourself, for your situation, and for your family. I do want to tell you that it is okay for you to be out driving in our city. Some cities are issuing permits to people who are part of the essential workforce. We're not going to issue permits. You might feel more comfortable if you have a letter from your employer saying, you know, this is who you work for and this is why you're out. But it is okay for you to be out. We need you to be working, and many of you are truck drivers or delivery people, and we've got to have those services in order for our city to function even on its most basic level. I appreciate the businesses that are shifting, allowing their employees to work from home. But that's not everybody's situation. And we want to try and work together to keep essential business functions in the city going, but keeping our employees who are doing that work safe also. All right, citizens, now I need to ask you for your help. I need you to go all in with us. I need you to wash your hands, and I would encourage you to set a timer on your watch and be intentional about washing your hands. If you're sick, do not go out. If you have a runny nose and you think, well, I think it's just allergies, let's all assume that it's the virus. That's what it's going to take for us to go all in and to fight the outbreak, to slow the spread, and to save lives. If you're sick, do not go out. If you're sick, get tested. You can call the health department at 378-6300, and they'll help you connect with getting tested if you have symptoms, and we want you to be tested. Stay positive. This one's hard. Because of the anxieties we have, because of the uncertainties, those are real, and I understand that they're real. But I'm asking you, Amarillo, let's stay positive. We can go all in on this order for the next 2 weeks. And we can do that not just by staying in our homes, but we can go all in with the messages that we're sending out too. How are you talking about this with your kids? What are you putting on social media? I'm asking that you would go all in with us to talk about a new form of patriotism, essentially. Let's talk positively about how we're pulling together in the city to fight this outbreak and to slow the spread. Certainly, it weighs heavily on us anytime we're having conversations about limiting people's freedom. And I can assure you this is a conversation that we have poured ourselves into, and we do not take it lightly. It's been based on data, and it's been not rushed into and not an overreaction, but truly a measured reaction based on the data that we have using the common sense that Amarilloans appreciate and use in our everyday lives. You may want to know how long the order is going to last. It becomes effective today at midnight, and it will last for 2 weeks if ratified by the City Council, which I hope they will do that tomorrow. At the end of 2 weeks, we're going to look at the updated data, we're going to reevaluate, and we'll see whether we need to extend it or not. The more we go all in, Amarillo, the faster we're going to come out of this. It is a new form of patriotism, and we all have a role to play. We've got to go all in to keep our medical staff, our medical professionals, and our medical community safe. If we're going to parties and having extended large family get-togethers, it's disrespecting the work that these people are doing every day. They're working double shifts, long hours, and it's going to get worse for them before it gets better. Their health is on the line as they go to work to take care of people who have this virus. I need you to go all in to protect our local healthcare community. I need you to go all in because it protects our hospital capacity. We have about 600 beds in our hospitals here in Amarillo, and those beds have to be available to the sickest people, not just in our city, but across the entire Panhandle region, even into a tri-state region. We've got to be smart, Amarillo, about how quickly we let this virus spread through our city. We must go all in to fight the outbreak and to slow the spread of this virus. If we'll go all in, it will save lives. So here's what I'm asking. Let's be all in, and let's be determined to fight this outbreak. If your family is all in, I want to ask for you to show your all-in patriotism. We're asking that you would display something yellow outside of your house as a sign of solidarity and support to our medical community. I want them, as they drive to work every day to fight this outbreak, I want them to drive down the streets and see that we're supporting them. So display something yellow outside your house. Maybe you have yellow balloons, or maybe you have yellow dish rags that you can hang outside your house, or a yellow flag, or maybe you're even going to dig out your Christmas lights and wrap them around a tree because they're yellow. Encourage your family. Use this as something positive. Get creative. I can't wait to see how we get creative in supporting our medical community. But let's display our yellow. Let's put our yellow pride out there as a support to them, to encourage them, to show them our gratitude, and most of all to say that we are all in and doing what we can to slow the spread and to fight this outbreak and to keep them safe. Yesterday, I watched President Trump's press conference, and he talked about how taking action now can save thousands of lives. Even as of today, 27 different states have some form of order similar to what we're doing to go all in Amarillo. That's 2/3 of our country. I know this feels drastic, but we need to join them today, and we need to go all in. I believe every single one of us is going to do our part to save lives here in the city of Amarillo and in the Texas Panhandle. Let's go all in, Amarillo, and let's beat this together. Dr. Milton?
That's good.
Okay, there you go, sir.
Good morning. I have a prepared statement. Section 81.002 of the Health Code of the State of Texas states, the state has a duty to protect the public health. Each person shall act responsibly to prevent and control communicable disease. I, as your health authority, have repeatedly strongly recommended social distancing, hand washing, avoiding large crowds, staying home if ill, and avoiding unnecessary travel in order to reduce the burden of COVID-19 in our community. As demonstrated by our contact investigation in the previously described cases, it is now apparent that I must issue an order to adhere to practices that mitigate the spread of COVID-19. This includes banning gatherings of 10 or more and social distancing that is best practiced by staying at home. Further, if in the community, all individuals must stay 6 feet apart. Testing should be reported daily to our office. This order will be in effect for 14 days. Of course, we will monitor this outbreak, and I anticipate the number of cases we document to increase. In 14 days, I will extend this order if the data suggests continued spread. Thank you.
Thank you, Dr. Milton. Now welcome Casey Stoughton, Public Health Director, City of Amarillo.
The announcement of this stay-at-home directive is one of the most effective ways for Amarillo to meet the challenge of how to prevent the spread of COVID-19 in our city and our community. COVID-19 has changed our lives. However, Amarillo always responds during times of challenge and adversity. We have overcome time and time again throughout our history by pulling together and doing what is necessary. This is what All In Amarillo is about, our city and our community uniting to accomplish a common goal. We encourage our residents to go to AmarilloAlerts.com to find out how they can help us as a community to stop the spread of this illness. The way we stop this illness is by working together. Stay at home whenever possible. Continue to maintain social distancing, which is at least a distance of 6 feet between yourselves and others. Wash your hands regularly and often. If you have symptoms, call your healthcare provider or the public health department at 378-6300. Amarillo can stop the spread of COVID-19 by doing what has been done so many times in Amarillo's past, uniting behind our community to accomplish a common goal.
Thank you, Casey. We do have a few questions for our panel. I want to start with Amarillo Mayor Ginger Nelson. Mayor, can you tell me how this directive applies to barbershops and hair salons?
It will close barbershops, hair salons, nail salons. Those are non-essential businesses, and those are the types of businesses that we need to close because it's impossible to keep the physical distancing requirements, which means to slow the spread and to fight the outbreak, those businesses have got to close. So, ladies, I'm sorry, for a couple of weeks, gentlemen, you're going to get scruffy, but we can do it. This is something we need to do for our community, and I have tremendous empathy for those business owners, the loss of income while they close their doors. But let's get past this. If we'll get past it now, then we can get back to working and get our businesses open. So those businesses will be closed under this order starting at midnight tonight.
Explain how it corresponds and relates to our public parks, city parks.
That's a great question. So how will this order change how we as citizens can use our public parks? Sadly, people have still continued to gather, and they haven't been physically distancing themselves at parks. Young people have been using them as a place to meet up with friends. I've myself seen pickup basketball games, and so we will be closing our park amenities. Our parks will be open, but all of the amenities will be closed. So all the courts, all of the playground equipment, the picnic tables, basically any facility that a park has will be closed to the public. And we're just asking you to do that for your safety, but also for the safety of others. So if you want to take your dog on a walk at the park, that's great. If you and your kids need to go burn off some energy and run around in the grass, that's great. But we're asking that you do that in family units only, and that you do not meet up for friends or play dates or any type of gathering at parks. They'll be closed to that type of use.
Can you tell how this new directive will be enforced?
Yes, enforcement is a good question. Let me just tell you, this order is about informing us. It's about informing us that we have community spread. It's about informing us how serious it is to slow the spread of this virus and go all in to fight the outbreak. So I'm asking for citizens to help us. The purpose of this order is not for us to issue citations or to try and police people abiding by the order. The purpose of the order is for us to be informed as a city about what it's going to take for us to fight the virus, slow the spread, keep our medical community safe, and most importantly, save lives of Amarilloans. So I think people will want to know, is it punishable? Yes, it's punishable by a fine, and in, I guess, an extreme case, by taking you to jail. But I'm confident, Amarillo, we don't have that situation, because what we have here is a heart to keep people safe, and what you have is a heart to keep those around you safe. So this order is about informing people what it is going to take in our city to fight the outbreak, and I'm confident that Amarillo citizens are going to help us on the enforcement side.
Thank you, Mayor. You mentioned this before in your opening statement, kind of reiterated again. How long is this in effect, and how long might it be in effect in the future?
It takes effect tonight at midnight, and it will last, once ratified, if ratified by the City Council, for 2 weeks. And so at the end of that 2-week period, we will look at the data that we have, talk extensively with our medical staff, and evaluate whether or not we continue to shelter in, or whether our numbers are indicating that it's time to start easing out of it. So a 2-week window, again, our approach has been a measured, data-based approach the entire time, and we're not going to stray from that now. So 2 weeks from now, we will again look at the data and make a good common sense decision on what we need to do as a community in order to continue fighting the outbreak and stop slowing the spread. Thank
you, Mayor. We do have other questions. I'd like to bring up Casey Stoughton, City of Amarillo Public Health Director. The drive-through testing facility, which started last Friday, kind of go through what is the process for people to participate in that drive-through testing facility.
So we were really fortunate to be able to offer a drive-through testing facility for our community starting Friday. We tested 46 individuals on Friday, and we opened again this morning we started taking calls around 8 o'clock this morning, and then the testing facility opened at 9 o'clock. If someone is interested in a test, they need to call our public health call center at 378-6300, and our call takers will walk them through that process. They will screen them for the need to be tested. We want to make sure that we test people who it is appropriate to test, because those supplies, while we have additional supplies every day, those supplies are not unlimited.
This is being updated daily with up-to-date numbers on positive tests, things like that. Can you go through the most current numbers that we have as of this morning?
Absolutely. As of this morning, we had 11 positive cases in Potter and Randall County. There were 5 cases in Potter County and 6 cases in Randall County.
This also might be a question for Dr. Milton of Texas Tech University Health Sciences Center. How many of the positive cases that we've had so far would be due to community contact, or do we have that information available?
So that number would be about 11 is that we have in the community. But I think what Mayor Nelson very clearly pointed out was how these clusters occur. And so it's well documented that it's in the community.
Okay. This also might be a question for Casey. Do we know how many of the positive cases might come from be travel related?
Yes, so we have 3 cases that are related to travel, and 5 of our cases are related to local transmission, and then 3 of the cases are still under investigation.
And this was mentioned earlier. I want to reiterate it again. How many pending tests do we have right now?
So with our increase in testing, so we had 46 tests that went out Friday. So we have 25 tests that are pending from the state lab at the LRN, and then we have 46 tests, or 43 tests that are pending from our testing on Friday.
How many of those individuals who tested positive, how many of them have required hospitalization as of this morning?
We have one that is required hospitalization out of out of the Amarillo cases.
Okay. Are there any plans, now that this new directive has been issued, are there any plans to change how the public is notified as far as the investigations of people who test positive, like where they may have been, where they may have gone? Are there any plans to alter that at all?
No, our plan for contact investigation still remains the same.
Okay. Those are all the questions that were submitted to us. We are going to allow the panel to do one-on-one interviews with the media. That will not be part of this broadcast. We will be doing 3 broadcasts a week, Monday, Wednesday, Friday, here on Facebook Live. Please join us again Wednesday. We want to thank everybody on our panel, and thank you for attending.
And just to reiterate, that was Mayor Ginger Nelson and city health officials saying that there is a shelter in order placed right now, and that will last for 2 weeks, and it starts at midnight. And of course, we'll continue with the coronavirus coverage on air and online, and details from the meeting, just head over to myhighplains.com. For now, let's send it back to programming.